You may have noticed Rachel and I are wearing red today. It's in support for American Heart Health Month. Today is National Wear Red Day for survivors of heart disease and stroke and bring awareness to their risk factors. Joining us now is Dr. Bhaski Patel, an interventional cardiologist, that is, at Hartford Healthcare. Thank you for joining us.
Thank you so much for having me.
So I really do appreciate today because as a woman, it's a good reminder on how we need to take care of ourselves and of course our heart health. And all of us have known someone, a woman who has been impacted by heart disease. We hear so much about it, why it's so important to be heart healthy. Can you talk about why today is so important for women and men who want to look out for the women in their lives?
Yes, absolutely. And thank you for bringing this topic up. We all know that heart disease is the #1 killer for men, but I think less people know that it's also the #1 killer for women. And women tend to present a little differently than men when it comes to heart disease. So, they're less likely to get treated. They're less likely to seek help. They're more likely to kind of to downplay their symptoms. So, men have heart attacks and they're clutching at their chest. They're having the sensation of an elephant feeling on their chest, all the things that we've been taught in TV shows and, Grey's Anatomy is what's expected. Mm-hmm. And women don't present that way. So they tend to have less typical symptoms. Sometimes they may have something that feels like reflux or burning pain or shortness of breath or anxiety, and that can be their equivalent of heart disease. So it's very important to recognize that just because it's not what you would expect, it doesn't mean that it's not important or requires medical attention.
And when we talk about heart health, we're not talking just about heart attack here. Can you talk about how to prevent stroke? Because that affects a lot of women.
Yes, absolutely. So stroke is also one of the one of the high risk cardiovascular presentations that we see. The #1 risk factor for stroke prevention is going to be targeting your blood pressure and making sure that that stays well controlled. A lot of that can be lifestyle, obviously a lot of diet, making sure that you're limiting your sodium intake, making sure you're keeping your weight at a reasonable target, staying active, all the things that our grandparents used to tell us back in the day all still hold true.
What are things we can all do, not just women, for our heart health today?
Really, prevention is key, right? So it is knowing your numbers, and that is something I'm very big on. Know your numbers, know what your blood level, your blood cholesterol levels are, know your blood pressure, know your blood sugars, and what normal is and what you're supposed to do to get there. The biggest thing is making sure that you have a heart-healthy diet, so that generally is a Mediterranean diet. Making sure that you're getting vigorous aerobic activity. The recommendations are 150 minutes a week of moderate activity or 75 minutes a week of rigorous activity. And it's easier said than done, but making sure you try to find ways to reduce your stress, because any kind of stress, whether it's physical, mental, or emotional, can all affect your heart.
That was going to be my next question. Actually, what's really disturbing is that our whole body health affects our heart, right? So including our mind. How can we protect our heart by managing our stress?
Well, there is something called stress cardiomyopathy, what used to be called as broken heart syndrome, something that we used to make fun of in novels and literature in the past, but it turns out it's a very real entity. It affects women more than men, but again, everyone can get it. And a large part of this is, again, finding ways to, whatever it is for you, finding ways to manage your stress, whether that means getting some fresh air, going outside for 5 minutes of activity. It doesn't have to be a 30-minute session. You don't have to make yourself sweat and breathe heavily. As long as you're getting out and doing anything that relieves your mind. For me, it's watching puppy videos on Instagram and listening to music. Whatever brings your stress down, it's different for everyone. So you just have to find your rhythm.
That sounds good. We like that. The puppy videos, that works. Thank you, Dr. Patel from Hartford Healthcare, for your hard and, of course, important work you do as a cardiologist. And thank you for your time today.
Thank you all very much.
Brent.